The following program is sponsored by Dr. Edmund Sulkowski.
Good morning, everyone. Cassie here, and welcome to Healthy Pets, Healthy People with your host, Dr. Edmund Sulkowski. And here he is now, Dr. Ed. Cheerio.
Good morning and welcome to Healthy Pets, Healthy People. I'm Dr. Edmund Sulkowski. You know, we have a fantastic show in order for you today. You're going to want to take this number down. Our number here at the studio is 844-302-1250, 844-302-1250. I'm opening up the show to calls from the beginning because we are going to talk about viruses today. We're going to talk a little bit about this COVID virus that originated in Wuhan, China, and what it's doing. I mean, we all see the impact that it's having on us. I drove here from home today and didn't even have to slow down. I only stopped when I hit a red light. So it's amazing how we're all complying and we're keeping ourselves out of contact from everybody, and that's part of the program, I think. But there are a lot of other things that we do. And I asked Dr. Dennis Courtney, our Dr. Dennis Courtney here from Pittsburgh, to come in and educate us, take that fear factor, because we're operating on fear. And I don't think that's a great way to look at things, out of fear. We have to be educated, and we have to understand the things that we can do, the empowering that we can take upon ourselves to keep ourselves healthy, to avoid this virus. And if we get this virus, some of the things that we can do. You know, our immune system is a big factor, and we need to support that. Dr. Courtney is going to talk to us about what a virus is and some of these measures that we can do to help keep us well. So welcome, Dr. Dennis Courtney.
Hello, Dr. Ed. So nice to be here with you today.
Always my pleasure, as you know, Dennis. And I have to tell you, I thank you for taking the time out. You know, we talk so much about the importance of stem cells and now the new exosomes. We're tabling that today, and you've been kind enough to come on and help inform our audience about this virus and the measures that we need to take. So the first question I have for you, what is it? You know, I think people in general, Dennis, confuse a virus and bacteria and what they do and how they impact us. What are the differences between a virus and, say, a bacteria? Contrast those two.
Yeah, I actually look at this in terms of what I call the big four. So in my world, I'm always concerned with the bug. We have all sorts of infectious potential invaders of our body. Each one of those can lead to some pretty serious diseases. But there are four bugs as far as I see it. I mean, there are bacteria, as you mentioned. There are fungi. There are parasites. And then there are viruses. Each one of those organisms has the potential to overwhelm the body and leads to symptoms of various types affecting specific organs as a result of it. And so for my entire career, meeting patients, dealing with patients that suffer from an infectious cause who are attempting to eradicate that bug has always been a top priority of mine. Viruses are just one of the four. I'll have to admit that I've been really involved with this special category of viruses and treating viruses for my entire career. I think I told you before we went on the air today that in my first year of my residency program, we had what we called grand rounds, and they held it every Wednesday, and it was for all the residents in the hospital to have a common lecture for the week. And there was a lecture in 1982, and the title of that lecture was An Unusual Phenomenon Occurring in the Gay Community of Pittsburgh, Leading to Suppression of Immune System. That's exactly how long the title was. And what we were being exposed to was the very first discussion of what ultimately and very rapidly became AIDS.
Acquired immune...
Human acquired immune deficiency syndrome.
Yeah.
So in my initial years of medicine, AIDS became what it became if we have listeners out there, and I'm sure we do, who remember that era, to get a diagnosis of AIDS was a death sentence.
Immediate death sentence.
And it was a death sentence within a month or two.
Yeah.
The death actually ended up being caused by these poor individuals had such a crushed and unfunctioning immune system that they could not fight off the most simple of infections. An infection that a 2-year-old could get rid of in 48 hours would ultimately kill the AIDS patient who had no immune system at all.
Because our immune system is designed, we don't live in a sterile world. We're not designed to live in a sterile world. We're not going to ever live in a bubble.
Exactly.
But we have this capability within our body, what we call the immune system, that fights these things off. It doesn't mean we're not going to get sick. It means that we have the ability to overcome those disease processes. And that immune system involves a lot of things. What? The spleen, the thyroid, the gut, the pancreas, help me out here. I just
bone marrow,
bone marrow,
lymph nodes.
Lymph nodes. That's what I was searching for. All of these things work together to help us fight that off. But when there's a problem somewhere along that chain of events where there's a disruption, that's where we get into trouble.
Well, that was sure the havoc that was causing those deaths back in that era. I actually have a little slightly different take, and I think it's worthwhile to share it with the listeners. And that is, even when we take the dreaded antibiotic, and maybe I shouldn't use the word dreaded because many people move to the antibiotic, they want help, which the antibiotic only helps if you have a bacterial infection.
Has no impact on the viral.
Has no impact on the viral.
Although you can get a secondary bacterial information because
if you have a viral
virus.
That's right. But even when the antibiotic is doing what it does, it can only work if you have a fully functioning immune system. So it is always the immune system that wins out in the end. It might need to be assisted by one of these drugs, an antibiotic, but the AIDS patient, no matter what you gave them, no matter if it was an antibiotic or not, they did not have any immune system to help out, and as a result, they succumbed. And we had nationwide this terrible a number of people from the gay community who did succumb.
And that you mentioned this antibiotic, and what if the antibiotic doesn't really cure even a bacterial infection? It just lowers the insult that then permits our body to be able to fight it.
The immune system can then, so in conjunction with it, the immune system, along with, if there's a very good aid, and in the world of bacteria, there are very good antibiotics. We have wonderful and amazingly powerful antibiotics. Now, that's a double-edged sword in a way because there's some potential harm that can come from them.
Absolutely.
But talking about the good side, they really are exceptional.
And we want to focus on the good side because we want to take this fear. I think everybody is walking around in fear right now. And I think that's probably a good idea because there are a lot of things that we're unaware of. Even with this virus, this COVID-19, they still don't understand this virus yet. And there's a lot of lacking of information out there for all of us, including medical professionals, I believe. But, you bring up this AIDS thing. I actually was admitted the first patient at Case Western School Clinic over there.
In the 80s, huh?
In the 80s.
In the 80s.
Yeah, and it was a complete fear factor when
we
walked in here. Dennis, we have to break for a
sure.
commercial.
Go ahead.
We'll be back in a minute. Our number, 844-302-1250.
There is a solution to your health challenge and one that will allow you to avoid both surgery and prescription medications. Take the time to find out more about the fascinating and miraculous world of stem cells. You are invited to attend a free seminar. Reserve your seat now by calling 724-888-3088. That's 724-888-3088. 888-3088. Become empowered with Dr. Courtney. Call today, 724-888-3088. Tell them Dr. Ed sent you.
Welcome back. I'm Dr. Edmund Sulkowski. This is Healthy Pets, Healthy People with Dr. Dennis Courtney, talking about what's on everybody's minds today, and that is this virus, or that's the virus in general. I mean, sickness in general, and what we can do to overcome it and to stay away from it. You know, Dr. Courtney, you were talking about your exposure at the beginnings in the early 80s with this immune suppressant virus. You know, there are different type of viruses, and before we go on to talk about this current one, let's talk about a difference between an RNA virus and a DNA virus.
Well, the double-stranded DNA viruses, which probably lead to the opening for the discussion of vaccines, because so many of the diseases where the vaccines have come into prominence have dealt with DNA viruses. Now, they're double-stranded. As such, the double-stranded forms of viruses normally aren't as problematic in terms of how it is that you can ultimately treat them and deal with them. I believe that the real culprits are the RNA viruses.
And this coronavirus, or coronaviruses in general, and I know this COVID-19 is an RNA virus.
Well, it then makes sense why the RNA virus, this particular one, could be so devastating, because when you're dealing with RNA virus, it's only a single strand of genetic material, and it needs a host.
And that's the factor here.
That's the factor.
You have to have a host. So, you know, we have to clean our surfaces, but that virus can't. There's actually controversy, and I think you'll back me up on this, whether a virus is alive or not alive. Some say it is, some say it isn't, some say it's in the in-between. Would you agree with that?
Well, especially back to the vaccines. We have live vaccines, we have attenuated vaccines, and we have dead ones. We also have this other category of DNA and RNA viruses. But the thing that comes to my mind immediately is the first RNA vaccine that we get turns out to be quite a problem, in my opinion, and that's in the at 18 months. We're supposed to receive, our children are supposed to receive MMR vaccines, and that is the first time two things happen. The first M of the MMR is for measles, and that first M is the first time we have two issues that have never occurred before in that person's life. The first is it's the first RNA virus that we get. All the other ones are DNA. And the second thing is it's live. And for those two factors, this M of MMR turns out to really have potential problems. We could talk about vaccines on another day.
We don't want to do that. That's a whole nother show.
That's a whole other story.
10 shows. But that is a problem because you have a little infant that has no immune system. That infant's dependent on the mother's immune system.
Need to host.
Yeah. So I had mentioned about wiping surfaces. So this particular COVID-19 virus, I see all different information. It can live on cardboard. It can't be on cardboard. It can live on cardboard 24 hours. It can live on plastics and hard materials, metals for up to 3 days. You hear all
We've
all
heard
these
it. We've
different
heard
things.
the equations. Yes, we have.
The bottom line is this virus needs actually body fluids to live on those surfaces. So if you're wiping those down and you're reducing the number, again, you're not trying to be sterile because you're not going to take your finger and touch a hard surface that even has an immediate virus on it, and it's not going to be absorbed through your skin and you're going to get sick. That's not the factor.
No, it's droplet.
So you have to have a number of basically a storm being in effect. You have to maybe have a depressed immune system fighting something else off, have a compromised condition like cancer treatment, cancers, asthma, whatever the case may be, and then this virus gets in through admission through where? eyes.
Droplets and respiratory invasion. So this is only, from my way I'm listening, I'm hearing this every single day. This is only through droplet contact, which are then brought into the mucous membranes. So you
where
could
they take
touch
hold.
Yeah.
They violate the cell membrane and actually begin to become part of that
So you
cell.
either breathe them in, or you touch a surface which has touched your eyes or your mouth, where the mucous membranes then take it up. So it has to be immediately taken from the droplet to the mucous membranes of your body, and there it thrives.
So over your career, we've seen these different viruses come about. I mean, not long ago there was SARS. There was
MERS, SARS. I think our listeners may remember something called Hong Kong flu, swine flu. These are all viral episodes of our past history where, in my world, every time one of these viruses comes into the picture, I am overrun with the attention that I have to pay to try to help alleviate the problems that are caused by it. So, yes, COVID-19 is much more virulent than the other forms.
I've read up to about 35% more.
Okay, much more virulent. I agree with you. But let's not forget, it is a virus. And I've seen viruses before, and it's just another one coming at me again. Admittedly, really different this time. We are all shut down and we're all hunkered down because we've been told, following the epidemiological staple of self-isolation and hygiene. These are the two measures.
Let's separate those two. Self-isolation is the big one. I mean, social distancing, which is a term I never heard before. Then I got to think from one of my banks saying distant banking. You know, that's another new term. So no one wants to touch anybody. Nobody wants to be around anybody. You know, we have 6 feet away. I mean, I even heard they closed North Park. I don't know why you would do that, but I heard that. I don't know if it's true or not. You know, I don't want to express false information here. But there's this thing about staying away. I can understand that, Dr. Courtney, if I have an immune compromised system, if I'm fighting something, if I'm going under cancer treatment, you know, any of these disease processes, I certainly would stay away from people. And granted, I'm not shaking hands. I don't even want to bump, right? You know, I'm washing my hands, and we want to talk about this mechanical debridement. But why is this social distancing so important?
Oh, no. This is a staple of epidemiology. This is how you combat. This is how public health mechanism works, by using isolation so that you cannot have one person come in contact with the other. In a way, I understand it, but in a way it's impossible, because if you are cloistered in your own home, you understand you have to leave it. For instance, you have to go to a store. You have to buy food. Well, now there's the very place that everybody has to meet. The government says all grocery stores will remain open as a national concern. Your drugstore has to remain open because the drugs are necessary. And so there's another place. There may be only very few places that you have to go to, but you have to go to every one of these. And when you go, yes, you're going to have to practice the social distance. That's where the 6 feet rule comes in. In your own home, you don't have to worry about the 6 foot rule because you got a door there. It's protecting you from the
contact.
Yeah.
But the 6 foot rule, that doesn't necessarily mean. Is that the fact that you're sitting across from me at the studio? And by the way, I wanted to do this at the beginning, and I forgot to do this. I want to thank Aaron and Gary for coming in
today,
making this show possible to be on the air. But granted, I'm sitting between a window and Gary and Aaron, but I'm not even joking here. I'm sitting probably 5 feet away from you.
Looks to be. Yeah.
Do I have to be concerned because I'm breathing on you and you're breathing on me?
It's all a degree, is it not? When I think that if we were a foot away, that'd be one thing. At 5 feet, I'm feeling pretty comfortable about our relationship here today. I don't think any of us are threatened by it.
Okay. And you and I as medical professionals understand, the fact if we have symptoms or not. But what's
Right.
kind of unique with this virus is you can have the virus be the carrier, be the vector.
Be asymptomatic.
And be asymptomatic, meaning you're not showing coughing, sneezing, temperature, aches and pains, sweating, or whatever the symptoms are. So that's a little bit different with this virus. Am I right?
Yeah, it's the fact that we feel that our young people who aren't really demonstrating the disease to any great degree, there are still many of them that are infected, and they are asymptomatic carriers, able to pass this on and yet not demonstrate the symptoms themselves because their immune systems are so really powerful when compared to an elderly person. So we're going to find out, because of the testing that's now available, we're going to learn all about that. That's the up and coming when the dust finally settles. And we've had so many tests run on young people, middle-aged, and the elderly. We'll be able to have a grand old time going over the statistics to find out how many of those young people actually did walk around and infect others. I, in a way, was really disgusted with the beach scenes in Clearwater. Did you happen to see
I did.
The teenagers of this world down there with their spring break, not thinking very much about.
Well, it's about me.
Yeah, about us in any way. Just thinking about them. So they're selfish.
Yeah.
And I'll never forget it.
Yeah, it's amazing. But this idea is, the way I look at it is, this testing is one thing. I'm seeing the results of testing. People that are tested, there's more people testing that are being tested and not showing that they have the virus than people being tested and showing that they have the virus. That's what I'm seeing. If the reports I'm reading are correct, I have no way of knowing that. I look at it as, if I'm in a category, then it's up to my responsibility to be in charge, to stay away from you, and I self-isolate myself. That's one of the ways I look at it. The second way, if I'm sick, then it's my responsibility to isolate myself and stay away from you, and I don't care if it's a cold, sniffle, or COVID-19.
By the way, the name changes. If you have the symptoms, you're no longer self-isolating. You're self-quarantining.
Self-quarantine.
Okay, so that's a whole different ballgame because you actually do have symptoms, and that's a big jump.
I mean, I don't want people coming to my house. I don't want,
Exactly.
I don't want people sitting in a car with me. I think it's important that we do that now because we don't understand fully. And when we come back, let's talk about the beginnings of what we can do, first of all, to treat this if we become sick, and talk about the various modalities that are out there.
Proactive.
As well as being proactive and supporting our immune system.
Okay.
We'll be back in a minute with Dr. Dennis Courtney. Our number here, because you got to have a question for this gentleman. You have an opportunity to talk to an expert here. And I don't throw that word expert out loosely. 844-302-1250. We're back. Remember, we don't treat or diagnose here, but we educate and inform, hoping to empower you to be in charge of your own health and your wellness, and now your life. When I walked into Aaron, said to me, well, we made sure we wiped everything down, and there's Clorox wipes here and everything, and I appreciated that, and that's something that we all should be doing. But you know what? We all should be doing that everywhere. I was on KDK radio last Sunday on Rose Unplugged, and when I was waiting to go into the studio, the housekeeping over there was wiping all the doorknobs down. Hey, that's something we should be doing it every day. We should be wiping the cash registers down. We should be wiping the belts that we place our products on, the carts, our own doorknobs, our own toilet handles, all of this stuff. That's common sense, and I think that's what we have to develop here, common sense. And Dr. Courtney, I'd like to talk to you about in a minute here about this difference between sterilization and mechanical debridement. But we have a caller. Let's take that call. Welcome, Debbie, to Healthy Pets, Healthy People. Do you have a question for Dr. Courtney?
Yes, I do. Good morning. I'm a healthcare worker, and I can't be 6 feet away. I am in my 60s, do have asthma, although controlled. I am wearing a mask. I'm wearing a gown. I'm doing the gloves. I'm doing the sterile. I'm doing all that I should be doing. Do you think I should call my doctor and ask him that I do not work because I'm a healthcare worker? I have to work. I don't know.
Yeah, well, you sound like somebody at high risk to me. What's your opinion on this, Dr. Courtney?
Should you call your doctor and ask him what? I missed that.
That I should not be working.
Oh.
Since I have the asthma, underlying asthma.
So you are at a higher risk. There's no doubt about that because of your underlying asthma. There are degrees of that risk, and you're a lesser level of risk than others, but nonetheless still risk. Now, the fact that you're using an N95 mask, I hope, correct? Is that correct?
Yes.
Okay, so
yes.
You've got all the proper defenses so that you're able to protect others very well and to protect yourself. So to the extent that I understand your concern, I feel that you're as in good a position as one could be to be able to work without the fear that you necessarily would contract any of these diseases because of the barriers you place between yourself and the potentially infected.
Do you work at a private office or in a hospital?
In a hospital.
Well, see, she's now seeing patients quite frequently, so she's at far more risk. What about eye protection? I mean, if somebody accidentally sneezes, and I don't know what she does in the hospital.
There's a shield on her.
You better be wearing a shield. You better be wearing gloves. You better be putting all these barriers up.
Yeah, and especially, by the way, are you in the units? Are you in the ICU or on the floor?
On the floor.
On the floor. Okay, so there are lesser afflicted that are on the floor, but nonetheless, they could very well be harboring the disease until you're tested. You don't really know. I'm guessing that they don't get admission into your hospital without a test nowadays because the tests are now pretty much commonly found. So that, would you say for the most part, the patients that you're treating have been already diagnosed with COVID-19 or not?
No.
Okay. So the risk is you don't know, and that's why you're going to have to be capped, gowned, and gloved, put that eye shield up. But I feel with all that, look, all healthcare workers are at a premium right now, and you are a member of that team. I understand the team. I, too, have been a past member of such a team. And as you know, the team shows up. You just need to protect yourself, and I think you are doing exactly what you need to be doing and should not worry about trying to say to your doctor, look, should I really be here or not? I think you're okay. I think you're all right with what you go through to protect yourself. Okay?
Thank you, doctor.
All right.
Thank you.
Thank you,
Sure.
Debbie from Oakland. Dr. Courtney, I want to move in a minute here into what happens if Debbie would start to notice some of these symptoms. But before we do that, explain that difference between sterilizing something and mechanical debridement.
Well, especially with the combination of two, you're really talking about the best way to protect yourself. So the sterilization of utilizing the wipes with the Clorox and the things like this are meant to actually kill the organisms. The debridement is, first, when you wash your hands, you need to wash in between your fingernails and all parts of your hand and scrub sufficiently to physically debride off the excess cells so that to wash alone without doing that is not going to be as protective as it ever could be without their inclusion. You have to include it.
So, you go to the grocery store, and of course, if the no toilet paper, issue and towel paper issue notwithstanding, there's no alcohol. There's no handy wipes. There's no, anything to help you debris your hands. So you've got to take it upon yourself.
Is there Clorox?
There's Clorox, so you can make a solution
You can
with
make a
Clorox
solution.
water. Do you happen to know that ratio?
Certainly not the strength. We don't use it full strength. You have to dilute it.
You have to dilute it. Yeah.
You have to dilute it, and I think that's easy enough found on the internet. So I would guide you to it. So there's always Clorox around to make those sterilizing solutions, and heavily use them and spray them. Your house should smell like chlorine if you're doing that adequately enough.
I mean, I think even Amazon is saying when you get a package, wipe it down and let it sit for a while before you open it up.
Yeah, I
and
hear
so
people
forth.
are opening up their boxes and their mail outside.
And using gloves,
And
of
using
course.
gloves, wiping down what's contained within the box, and then bringing only that into the house, while the box and the discarded envelopes will remain outside to be dealt with later.
Is that being overly cautious?
It certainly is a level of caution that I had heretofore never heard of before, but we're in a different set of times.
Okay. So now, what can we do? And that's a general open question here, and I'm going to ask you to include what can we do, our best measure to prevent it, and and maybe that involves immune system support, and what do we do if we get it?
Let me jump in and back into that just first.
Okay.
Because I've been on the internet, who hasn't? And I dialed up antivirals because, we were talking about antibiotics earlier. And I've always been in the mindset that as good as our antibiotics are, that's how poor our antivirals are. I've never really felt that we've ever had a good antiviral to bring into the hospital setting, into the treatment setting. So I went on the internet and I dialed up an article out of the Cleveland Clinic, a fairly prestigious institution, you would agree. And this was dated November 2018. And the article was on how well the antivirals were working on the flu season that year. All right? So there was a relationship. It wasn't with COVID-19. It would have anything to do with what was the flu for that year. And so there were 4 antivirals. Some of you heard of before. Tamiflu was one of them. I think most people have heard of that.
Has limited use according to time.
That's right. Relenza was another one I think it's familiar, the public's familiar with. But the part of that article from the Cleveland Clinic that caught my eye was when you use those antivirals, which you can expect, if they work the best, would be that you can shorten the symptomatic period of your flu by 1 day.
That's
1 day. So if it was going to last 5 days, it may very well last 4. And I looked at that and I went, what the heck? Would anybody? So you subject yourself to, by the way, the side effects of these are amazingly, there's some terrible consequences here.
Well, when that virus enters that host cell and takes over that cell, it's hard to kill the virus without killing the cell without killing you.
The antivirals we have are not good at all. I hear them being thrown about on the TV reports we keep getting about how that's part of our treatment, but I don't look at that as being a treatment at all. If at its best, that is able to shorten your
symptoms
by 1 day. So that's the first thing I want to get out by answering your question. The second thing I want to get out is over these many years now, and I admit that back then in the day of my residency at West Penn Hospital, I was a trained conventional doctor, thought just like conventional doctors think, and we didn't help many people back then, okay? And many of them succumbed. But as I grew into a more alternative approach, a more holistic approach, the ability for me to take on viruses has become, I believe, very interesting in that I feel that the American it is not in his nature to sit this one out, meaning to just cloister yourself in a room and not go out, and then to wash your hands. And this is happening now as the main instruction from the powers that be. This is what you do. This is all you do. As if to say there's nothing else you can do. I say, no, there's plenty to do.
We're going to break. When we come back, please tell us the plenty we can do.
Okay.
There is a solution to your health challenge and one that will allow you to avoid both surgery and prescription medications. Take the time to find out more about the fascinating and miraculous world of stem cells. You are invited to attend a free seminar. Reserve your seat now by calling 724-888-3088. That's 724-888-3088. Become empowered with Dr. Courtney. Call today, 724-888-3088. Tell them Dr. Ed sent you.
Welcome back. I'm taking a call. We have a caller, Cassie from Bell Vernon. Cassie, I would ask you to keep your question quick and easy. We don't have a lot of time left, and I need Dr. Courtney to talk about the things that we can do. But what is your question quickly?
Will they show antibodies if they go to test everyone, or will it show that you don't have it anymore?
No, once you have tested positive and you've gotten through the disorder, there will be antibodies left as a residue, as a marker that you once had the disease. I think that's the answer to your question.
Okay, thank you.
All right,
Okay.
thank you
care.
for calling.
Bye-bye.
Dr. Courtney, what can we do? What?
Yeah.
That
so,
question we posed before.
so these many
commercial.
different viral episodes that have occurred over the last 20 years of my career. There's one thing in my world of alternative medicine. All doctors in my world, of which there are probably about 5,000 of us throughout the country, a standard staple item in our offices is the use of vitamin C. This has been controversial, and certainly in the conventional medical community. So I'm not here to win over people who just can't seem to wrap their head around this idea. But in my world, it's pretty much understood that vitamin C, both oral and high-dose intravenous vitamin C, are great measures to protect against ever getting infected with that virus.
So you say oral or IV. Now there's a difference in how we absorb oral, and there's a difference in the type of vitamin C that we absorb and how it's carried.
Let's just talk about that. Let's talk about the oral first. So as you sit at home today wondering what can I do, I say you can and should consider taking oral vitamin C. The problem is the public isn't educated enough to know how to select that vitamin C, because we have to tell you that, of course, vitamin C is water soluble. And as such, you absorb very little of a vitamin C tablet. They make something called a 1,000 milligram tablet. If you look at it, it looks like it would choke a horse. And by the way, it chokes me. So
You only absorb about 35% of that.
Well, actually, it's only 3 to 5%. So that means that on the best day, if you get regular vitamin C that's water soluble, and you fight to get that 1,000 milligram tablet down your throat, which is a battle for me, on a good day, you might be able to get 30 to 50 milligrams of it actually in your blood.
Which isn't enough to even fight off scurvy.
Which is sort of ridiculous. So, boy, is that a message to take to the public. Now, you can't use regular vitamin C for two reasons. One, it's water soluble, and what will end up happening is that at about 5,000 milligrams, the internal environment of the colon is over taxed, and you end up having diarrhea, pretty intense diarrhea, because you can't absorb any of that. So the first thing you have to be looking for is what's called liposomal vitamin C. vitamin C, which has a globule of fat literally located around it that allows it complete access through the mucosa.
So that's
So-
phosphatidylcholine that's
Well, that's
wrapped
usually
in.
the fat that causes and forms a liposome. So I may be introducing a new term for the first time to the majority of our listeners, but your vitamin C must have two things. One, it better be liposomal because, see, if you take 1,000 milligrams of liposomal vitamin C, you will absorb 1,000 milligrams or thereabout. So that's a good deal, right?
Right.
Number two, the source of that vitamin C now is also extremely important because 99% of all vitamin C, I know that maybe you don't know this, but it comes from corn.
Yes.
And at this point in our agricultural evolution, just about all corn is genetically modified. And anything that's genetically modified, in my opinion, has created a Franken molecule, and I don't recommend any GMO anything to be taken, especially vegetables that we eat and are grown that way, or
our supplements.
For supplements.
And I would agree with you 100%. And people that listen to us know about liposomal C, and they know about GMOs as well. So I want to take this another step further because I know there's something you do in your office, and it's called IV vitamin C.
Yeah.
What is that?
We can bypass the gut entirely. So the person sitting at home today can take charge by just heading to the internet or the health food store looking for non-corn derived vitamin C. And the sources usually that are non-corn derived that are in the marketplace, number one, soybean, and number two, tapioca.
Well,
so you're going to find those two.
Soybean is a lot of GMO also, so you have to be careful.
Well,
but the tapioca is
it'll
not.
be labeled non-GMO.
Right.
Has to be labeled non-GMO.
Right.
So this is something where taking 5,000 milligrams a day or something like that will do very, very well. But the best of all is to use high-dose intravenous vitamin C, where you bypass the gut completely. And we do those vitamin Cs and have done them in our office for many years now. And it's been our go-to as a prophylactic.
And a prophylactic meaning as a prevention.
As a preventative for ever getting the virus to begin with.
Because what this does, because it has its own properties, but it also is an immune system builder. And it helps support your immune system, is what you're saying.
Well, actually, there's a specific mechanism involved that I share with every one of my patients. I might as well share with our listeners. Number one, that when you take in vitamin C, no matter whether it's the oral or the IV, vitamin C is taken up by all cells in the body, those which are healthy, and those, by the way, which are diseased. And the very viruses that we're talking about also take them up, okay? In a regular cell, which has a healthy oxygen quantity involved with it, all healthy cells do, the vitamin C confers its antioxidant properties onto that cell and literally creates a supercell and allows that cell to ward off and fight off potential invaders. So what a great way to help your already healthy cells to remain healthy. So that's one aspect of how vitamin C would be beneficial. But let's talk about the very virus itself. Because, you know, this vitamin C is taken up within the virus. But in the virus, we have a completely different environment. It is hypoxic, meaning very little oxygen. And when we're in a hypoxic environment, you don't get the antioxidant property of the vitamin C. Vitamin C then becomes a major oxidant, and it takes intracellular hydrogen and oxygen and makes a product that we all know. It's called H2O2, and everybody has it in their medicine cabinet at home.
We're out of time, Doc. Hey,
hydrogen peroxide.
Hydrogen peroxide. So You can get a hold of Dr. Courtney if you want to talk to him further about this at 724-888-3088 or your office number.
724-942-3002.
Hey, thank you, Dr. Courtney, for coming on and educating our clients. Remember, healthy pet's a happy pet. When you're healthy, you're happy as well. We'll talk to you next time. Thank you for listening. God bless.